Now let's talk about strokes. But more importantly, there's something you need to be completely on top of for your nursing exams. We're going to break down everything you need to know about strokes, from what happens in the brain to how to provide the best possible care for your patients. This is high-yield stuff, people, so grab your notebooks, get comfy, and let's get started. So what exactly happens during a stroke? Picture this. Your brain, the control center of your entire body, relies on a constant supply of oxygen-rich blood delivered through a network of blood vessels. Now, imagine a traffic jam in one of those crucial highways. That's essentially what a stroke is, a disruption of blood flow to a part of the brain. This lack of oxygen causes brain cells to die, and depending on the area affected, can lead to a wide range of disabilities. Now, there are two main types of strokes: ischemic and hemorrhagic. Ischemic strokes are like those traffic jams I mentioned earlier, caused by a blockage, usually a blood clot, in a blood vessel supplying the brain. They're the most common type, accounting for about 85% of all strokes. On the other hand, hemorrhagic strokes are more like a burst pipe, where a weakened blood vessel in the brain ruptures, causing bleeding into the brain tissue. And then we have what we call a transient ischemic attack, or TIA, often referred to as a mini-stroke. This is a temporary blockage of blood flow to the brain, and the symptoms, though similar to a stroke, resolve completely within a short period, usually minutes. However, don't be fooled by the mini label. A TIA is a serious warning sign, a bit like your body waving a red flag, telling you that a major stroke could be on the horizon. Now let's talk about who's at risk for stroke. Some risk factors, unfortunately, are beyond our control. We can't change our age, gender, or family history. Men are generally at a higher risk of stroke than women, and the risk increases significantly after the age of 55. Your ethnicity also plays a role, with African Americans and Hispanics facing a higher risk of stroke compared to other ethnicities. And of course, if you have a family history of stroke, your own risk unfortunately goes up. But here's the good news. Many risk factors are modifiable, meaning you have the power to change them. Think of it this way. You hold the reins to your health. High blood pressure, often called the silent killer, is the #1 cause of stroke. Smoking, obesity, a diet high in saturated and trans fats, and a lack of physical activity all contribute to your stroke risk. Diabetes is another major risk factor, increasing your chances of having a stroke by 2 to 4 times. The key takeaway here is that while you can't control everything, you can definitely take charge of your health and make lifestyle changes to significantly reduce your risk of stroke. Remember, prevention is always better than cure. Time is brain. You've probably heard that before, and it's absolutely true when it comes to stroke. The faster a stroke is recognized and treated, the better the chances of a good outcome. That's why it's so important to know the signs and symptoms like the back of your hand. Think of the acronym FAST, facial drooping. Is one side of the face drooping or numb? Ask the person to smile. Does it look uneven? Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? Speech difficulty. Is their speech slurred? Can they repeat a simple sentence correctly? Time to call 911. If you observe any of these signs, even if they are subtle or temporary, call 911 immediately. But it doesn't stop there. Other symptoms of stroke can include a sudden, severe headache, often described as the worst headache of my life, sudden vision changes like blurring or double vision, loss of balance or coordination, and a sudden change in their level of consciousness, like confusion or disorientation. Now, here's where your nursing knowledge comes in. It's crucial to understand the difference between right and left brain strokes. A right brain stroke can lead to left-sided weakness or paralysis, vision problems, and poor judgment or impulsivity. On the other hand, a left brain stroke can cause right-sided weakness or paralysis, speech and language difficulties, aphasia, and slow, cautious behavior. Diagnosing a stroke quickly and accurately is like solving a puzzle. And as nurses, you play a crucial role in putting those pieces together. It starts with a thorough neurological assessment, but we need to confirm our suspicions with imaging. The gold standard is a CT scan, and here's why. It helps us differentiate between an ischemic stroke, caused by a blockage, and a hemorrhagic stroke, caused by bleeding in the brain. This distinction is absolutely critical, because the treatments for each type are vastly different. But we don't stop there. An MRI, which provides a more detailed picture of the brain, can help detect early ischemic changes that might not be visible on a CT scan. We might also order a carotid ultrasound to visualize the carotid arteries in the neck, looking for any narrowing or blockages that could be contributing to the stroke. And finally, an echocardiogram, which uses sound waves to create images of the heart, can help identify any potential sources of blood clots in the heart that may have traveled to the brain, causing the stroke. Remember, a stroke is often a symptom of an underlying problem, and our job is to figure out the root cause so we can provide the most effective treatment and prevent future strokes. Alright guys, this is where things get really critical. When it comes to stroke, remember those 3 magic words: time is brain. Every minute counts because brain cells are dying. For ischemic strokes, our goal is to restore blood flow to the brain as quickly as possible. One of the most powerful tools we have is TPA, short for tissue plasminogen activator. It's a clot-busting medication that can significantly improve outcomes if administered intravenously within a narrow window of 3 to 4.5 hours of symptom onset. Now, TPA isn't a magic bullet, and it's not suitable for everyone. There are specific contraindications, such as active bleeding, uncontrolled high blood pressure, and recent major trauma or surgery. If a patient is not eligible for TPA or presents outside the treatment window, we might consider aspirin to prevent further clot formation. For larger vessel occlusions, a procedure called mechanical thrombectomy may be performed. This involves using a catheter to physically remove the clot from the brain. It's a minimally invasive procedure that has shown remarkable results in improving outcomes for patients with severe strokes. As nurses, you are the eyes, ears, and hands on the front lines of stroke care. Your role is absolutely critical in ensuring the best possible outcomes for your patients. From the moment a suspected stroke patient arrives, it's a race against time. Your assessment skills are paramount. Remember your ABCs: airway, breathing, and circulation. Is the airway clear? Are they breathing effectively? What's their blood pressure like? Monitoring for complications is key. Keep a close eye on their neurological status, looking for any signs of deterioration. Maintain a strict fluid balance and be vigilant for signs of aspiration. Remember, swallowing difficulties are common after a stroke, so a swallowing evaluation is crucial before anything is given by mouth. And finally, don't underestimate the importance of emotional support and patient education. A stroke can be a life-changing event, and your patients and their families will be looking to you for guidance and reassurance. Provide clear and concise explanations, answer their questions honestly, and offer resources and support groups to help them navigate this challenging time. Okay, future nurses, let's talk NCLEX strategy. Stroke is a high-yield topic, so be prepared to see it on your exam. Remember, the name of the game is prioritization. What would you do first? What's the most important thing to monitor? What are the potential complications? When it comes to stroke, time is always of the essence. Know your TPA window cold, 3 to 4.5 hours from symptom onset. Be crystal clear on the contraindications for TPA and understand the rationale behind each one. Remember, safety first. Positioning is another key concept. For ischemic stroke patients, the head of the bed should be elevated to 30 degrees to improve cerebral blood flow. And always be on the lookout for signs of neurological deterioration and report them to the healthcare provider immediately. Finally, don't just memorize facts. Understand the why behind them. Why is controlling blood pressure so important in stroke management? Why do we keep patients NPO until a swallowing evaluation? The more you understand the rationale behind the interventions, the better equipped you'll be to answer those tricky NCLEX questions. That was a deep dive into stroke, and you made it. Remember, early recognition and rapid treatment are key to improving patient outcomes. You are the first line of defense, the advocates for your patients, and your knowledge and quick thinking can make all the difference. Keep practicing, stay curious, and never stop learning. You've got this. Good luck with your studies and your NCLEX.